genius? You dummy on purpose? I don't know why. Nobody knows what's going wrong in this for-profit fucking not capitalistic hellscape of a healthcare system where we suppress early treatments, keep drugs from dying people so we can increase the profits of big pharma. That's exactly what's going on. The reason why there aren't ICU beds is not because we can't afford them, but because they're not profitable. And so we never have enough ICU beds, and every flu season they get overrun. Can you turn this off? Yeah. Because the neo-libs who run our healthcare system are busy trying to make a profit off everything. Akin. That would be why. Akin. Liar. At a White House briefing at the end of August, Fauci, President Joe Biden's senior medical advisor, listen to this. He implored doctors to use monoclonal antibodies more frequently. Noting that they can reduce the risk of COVID-19 hospitalization or death by 70 to 85%. That's so funny because I have seen Dr. Fauci on TV a million times. And you know how many times I've heard him say this? Zero. Why wouldn't this be the first thing out of his mouth every time he talks about COVID? I'll tell you why. Because Dr. Fauci is a corrupt criminal who is keeping information from you on purpose at the behest of Big Pharma. That's why. Because Dr. Fauci is a criminal who should be in jail, and that is not hyperbole. He is a bigger liar than Ted Cruz and Rand Paul put together. He's been lying for 40 straight years and screwing over American people. I got to get my jokes. So, Fauci urges hospitals to use more COVID-19 antibody treatments. Look at that. This is very effective intervention for COVID-19. It is underutilized, and we recommend strongly that we utilize this to its fullest, Fauci said one time under his breath. We want people out there, including physicians as well as potential patients, to realize the advantage of this very effective way of treating early infection. What? I'm going to bet you the first time most people heard about this was on this goddamn show. When asked by CNN why more doctors and health centers aren't getting antibodies to their COVID-19 patients, Fauci said, I can't explain that. Oh. Wow, so I guess there are some things that science just can't explain, huh? What happens to us when we die? What is consciousness? And of course, why is the effective treatment for COVID being blocked? Those are some of the questions we'll just never be able to answer. You motherfucker. They wouldn't explain why. They won't explain why. Star Kidda did everything she could to get monoclonal antibodies for her father, and she failed. Last month, Kidda's 68-year-old father, John Daniel, who lives outside of Atlanta, he tested positive for COVID-19 even though he was fully vaccinated. He had a fever for days and couldn't get out of bed. 5 days after he started feeling ill, Daniel had a video call with the physician's assistant in his family doctor's office. Daniel says she made no mention of the monoclonal antibodies, even though he's over 65. Then his daughter, a psychologist with the U.S. Department of Transportation, spoke on the phone with her doctor, but she said he also made no mention of monoclonal antibodies. Wow. Doesn't that tell you that America has the best healthcare system in the world? I hope he didn't become radicalized for Medicare for all or something because of this. I hope not. Here we go. Kidda's cousin, a nurse, then told her about the treatment. So Kidda called the government hotline for monoclonal antibodies and was given the names of the numbers for 10 treatment sites near her father's home. 8 of them were like, "Why are you calling us?" She remembers. Can you fucking believe this?
I mean, you have to call Dana White. 8 doctors won't.
That's right.
Won't tell you.
Because doctors won't tell you about it. You got to call Joe Rogan and Dana White and listen to a pothead comedian's podcast. Let me watch. Let me read this. The 9th Treatment Center said her father would need a referral from his doctor. Kidda called her father's doctor, but she said she wouldn't give a referral and wouldn't explain why. Is it because, I don't know, doctors' boards and things are pressuring people to only use the vaccine and not use those treatments? Is that why? Because that's what my doctor told me. My doctor told me that they sent out a letter to every fucking doctor and doctor association and hospital and warned them that doctors are going to lose their license if they start telling people about treatments. That's what my doctor told me. That's what my doctor told me. So, why is this happening? I'm going to guess that's why it's happening. Because Big Pharma has a stranglehold over our medical system and our corporations, corporate news, and our government, and our FDA, CDs. The Big Pharma has captured them, and they're
Seriously,
corrupt.
Why is CNN reporting that? Is it like a thing you just slip in? Like, why would they even be? Did someone get breakthrough COVID and they couldn't get monoclonals who works at CNN?
Maybe that happened. But here's this woman. She's doing her own research. Now, you're not supposed to do that.
Yeah.
That's shunned now today, even though she's a doctor. So here we go. There's more. The 10th center said it would take the first 50 people who showed up in the morning. Daniel arrived 15 minutes after the center opened, and there were already more than 50 people in line. Well, why were you late? Her father never did get an antibody treatment. It took him weeks to fully recover from the virus. I just don't understand why it didn't happen. I just told you why. Because we live in a corrupt system that's run by Big Pharma's money. Big Pharma made, just Pfizer alone, made $35 billion off their vaccine. That one vaccine. Forget about all the rest of the drugs they sold. They made $35 billion off that one vaccine. How much money, power, and influence does that $35 billion buy you? Well, I've said this on the show before. The entire recording music industry in the United States only generates $12 billion a year. The entire recorded music industry in the United States only generates $12 billion a year. Pfizer, one company, is going to make $35 billion off that one vaccine. And then they own the news media and they own your government. And now you know why you can't get real treatments? That's why.
I mean, Jimmy,
why did they make ivermectin sound like a poison horse paste? Because they're bought by Big Pharma and they can't make money off ivermectin because it's a generic. Go ahead.
I was going to say, the music industry only makes $12 billion. That's only enough for like 3 years worth of Pfizer fines for false.
That's right. Okay. In New York, months ago, a shoemaker, a lawyer, and 3 housewives saw the need for antibodies in their community. By the way, a shoemaker, a lawyer, and 3 housewives. That sounds like the beginning of a joke, doesn't it? Am I wrong? But it's not a joke. And in fact, it's just a reality, sad reality of our garbage healthcare system. A shoemaker, a lawyer, and 3 housewives saw a need for antibodies in their community. In September, the group called CPI arranged for several hundred antibody treatments a week, she said. Isn't that something? Bernstein said she often finds herself on the phone explaining to physicians the benefits of antibodies and which patients are eligible for them. I'm not a medical professional, and here I'm telling doctors things they don't know. Hey, Mr. Aioli, I don't know if you saw this report from CNN. Bernstein said, and hands down, we have saved lives. I can't walk down the street anymore without having someone say, you saved my life.
I hope she's in prison now.
Yeah. Dr. Lindsay Batten, an infectious disease specialist and associate professor at Harvard Medical School, said some medical systems might have been slow to implement antibodies at first because they weren't sure how well they worked. Oh, that's why? Let's just let the guy die. Should we try the monoclonals? I don't know if it works. Well, should we try it? I say we let him die. What the fuck kind of bullshit is that? But as additional data emerged in real time, he said the treatment's effectiveness has become clearer. He added that it can be hard for institutions to operationalize a new treatment, even though it involves shots or infusions, both of which are given in hospitals countless times every day. Isn't that amazing? Wow, it's so confusing. How do we get this treatment to people for COVID? There's just a million problems. How do we get them the vaccine? No problem. Everybody can get it anywhere outside anytime. What about the monoclonals? I don't know what it's systems and operationalized, and we gotta get the things, and I don't know. My doctor doesn't even know about it. But how can I get the vaccine? Every corner in the fucking America, you can get the vaccine. What about monoclonals? It should be easy, but there's infrastructure. There's fluid bags and pumps that have to be set at right rate and the right tubing. And not every tubing is right for every pump. And you have to have a computer system that allows you to put it in the right order and the right label on the right bag. You know, like medicine. You know, like how you have the right label on the right bag so people get the right fucking drugs? You mean why there's a chart hanging on the foot of everyone's hospital bed? You mean that kind of a thing? Go ahead.
The mask, you're gonna be fiddling with it, and you get some schmutz. You don't want the masks and the monoclonals.
You don't want the schmutz and the thing, and you might think a mask helps you, but it doesn't help you. That's what Fauci said, and then admitted he was lying. None of this is rocket science, and I'm not raising this to say these are insurmountable. He added, these are speed bumps, but this is all solvable. This is a solvable problem. Yeah, I know. What the fuck? None of this is rocket scientists. A doctor is saying that. A doctor is saying that. You know, doctors aren't rocket scientists, so that's encouraging. So now Dana White is a rocket scientist. Look at that.
Wait,
now.
Are you a rocket scientist, Jimmy? Are you a rocket scientist?
I'm not a rocket scientist. By the way, it shouldn't be this hard. Colorado COVID patients struggle to get monoclonal antibodies. Why would it be hard? Why is it hard? Unless our institutions absolutely suck and we should rethink every level of our for-profit medical system. Oh, maybe that's it.
Wait, our efficient private system? What?
Why would you want to change this?
What are we, socialist? Why is it hard?
That's right. There's a shortage of monoclonal antibody treatments. Here it is, Forbes, and that's from December of 2021.
Oh.
COVID patients have trouble getting monoclonal antibodies treatment due to short supply. It's heartbreaking. That's from December 30th. Monoclonal antibody treatment still difficult to obtain. This is from January 7th, 2022.
I know what it is.
What is it?
Probably need it for the horses.
That is
it. You can't just take their medicine all the time.
Right. We're giving them monoclonal ponies. So this one says COVID-19 therapies are scarce in San Francisco as Omicron surges. Health officials, listen to the subhead. Health officials cling to vaccines and boosters as the way forward.
But what if I got breakthrough COVID and I'm all vaccinated?
Why are they clinging to this? Again, not mentioning monoclonals because the monoclonals are scarce. Also, here's that. Oh, that I already showed you that. This is the stupid. That has nothing to do with this.
Good stuff.
Good stuff. That's the good stuff. So there you go, ladies and gentlemen. Now you know the story of monoclonals and Dana White and how the establishment is keeping them from you on purpose.
What the heck was that?
And Fauci doesn't know why.
Was that
they don't know why. I think we all know why. Because our entire medical system is bought by Big Pharma.
Kind of raunchy.
$35 billion something because of this. I hope not. Here we go. Kidda's cousin, a nurse, then told her about the treatment. So Kidda called the government hotline for monoclonal antibodies and was given the names of the numbers for 10.
Need it for the horses.
That is
you can't just take their medicine all the time.
Right. We're giving the monoclonal ponies. So this one says COVID-19 therapies are scarce in San Francisco.
Good stuff.
Good stuff. That's the good stuff. So there you go, ladies and gentlemen. Clinging to this. Again, and boosters as the way forward.
if I got breakthrough COVID and I'm all
Why,
vaccinated
why
like I
are they
am.
clinging to this? Again, not mentioning monoclonals because the monoclonals are scarce. Also, here's that. Oh, that I already showed you that. This is the stupid. That has nothing to do with this.
Good stuff.
Good stuff. That's the good stuff. So there you go, ladies and gentlemen. Now you know the story of monoclonals and Dana White and how the establishment is keeping them from you on purpose. And
You know,
Fauci doesn't know why. Howard Stern. So shame on you for repeating propaganda uncritically that came by several governments and several big corporate news stations, and they've done it. And you're a chump, and you're a dupe because you're being lied to at the speed of science every fucking day.
the speed of
Every day you're being lied to. And guys like my close friends who are for mandates have no idea what they're talking about and have become unbelievable authoritarian pussies like Howard Stern. So shame on you for repeating propaganda uncritically that came straight from Big Pharma. Shame on you for not fucking criticizing that criminal Fauci and that criminal who used to head the NIH and the criminal corporate news people who keep lying to you about COVID. Shame on you.
Can you imagine, Jimmy, if there's any unvaxxed rocket scientists out there? There's got to be one.
There's got to be one.
Howard Stern would call for them to die in space.
If people knew how many PhDs are unvaccinated, it would make their head explode.